it's like aging, the aging face, isn't it? We lose volume, our ligaments stretch, our muscles become loose, we lose fat, volume in our fat pads. And often on a female face, we start morphing more into a masculine face. So we lose that golden ratio just through age, because, I always say to my patients, I'm full of depressing facts, basically, but our skeleton shrinks, everything just changes.
Yeah.
So by restoring a look your natural best image, all we're doing is enhancing those lost pockets of volume. We're just lifting slightly. How many times does a patient say to you, I hate my jowls, and they're kind of doing this, and we're thinking, no, we're not going to restore your jowl by pulling you back like that. That's surgery, and that can work. But you enhance here, don't you? And that just restores that natural balance.
Can I ask you something? So how much are you paying attention then to, if you like, you become nurse X-ray, you're looking at their face and thinking, wonder how big their skull is underneath all of that tissue. And how important is it to you that you're feeling confident that you know where the tissue is, where the arteries and nerves and veins are, with regards to thinking, I can restore some of that lost volume, but hang on a minute, is it safe to do so?
It's fundamental. It's fundamental for a multitude of reasons. First and foremost, patient safety. So if I'm injecting in an area that's unsafe or to an unsafe depth, this is a really good example because it's the most commonly reported area around the mouth and around the nose where we see necroses, where someone with a lack of training maybe has injected a filler and it's put pressure on an artery and it lacks circulation. So it's the first thing I'm thinking. You don't place filler typically too superficial in this area because it's not safe. But on top of that, if you're placing a product, I'm thinking if I'm placing a product in the wrong plane of the face, so if I'm too superficial or too deep, whichever, it's going to look weird as well. You'll get lumps. We use a great product, so we don't often see lumps, but equally, tear troughs are really good examples where if product isn't placed deep down, it makes the eye look worse instead of better. And that happens over time because hyaluronic acid loves water, doesn't it?
Yeah.
It's a molecule that goes in and then over the space of months, it just expands, which should be really complementary. So I'm thinking, I'm not going to see a result. You'll see some impact right away, but it will get better and better and better.
How much has it helped the fact that you have a nursing degree, which is a science degree, understanding things like molecular weight and chemistry and of course anatomy? And can you imagine not having that background and injecting?
No, I couldn't. I think, even on top of my nursing degree, as you know, we've both done multiple additional qualifications and training years to build upon our competencies. And quite proudly, we sell it as one of our unique selling points for why come to Qutis. But it's aside from the obvious, and I like to think it's obvious to our patients that we're safe, but we're thinking about their golden ratios. We're thinking about how can we make someone not look like they've had any treatment, but look very well.
And other things that we're thinking about, like health, for instance, because I'm sure you'll recognise that even our practice has evolved over 10 years, and I've been almost in 30 years in practice. It's evolved in terms of things that a patient may have to take for their health, and then how do we marry that up to what we're proposing in terms of skin health or aesthetic health? Do you find that you're dealing with more complicated patients with their medical background or their medicines background?
It's interesting. I'm surprised. When I came into medical aesthetics as a nurse, it's easy, I think, to think it's going to be easy, because you're just doing a little bit of this, you're just doing a little bit of this, or it's just skin. And I came out of cardiology, which is very complex, but skin is highly complex, so much so that we still don't have a lot of solutions to very complex skin conditions. You know, we can treat them, but you can't obliterate them completely like rosacea. But the causative factors of rosacea, a really good example, gut health is imperative. It's imperative for all skin health, isn't it? So I think having the tools to be able to address someone's impact of their medicines that they're taking, and someone's diet, and someone's lifestyle overall, you know, that biological, psychological, and sociological variables that impact the patient, enables us to deliver a really holistic service and an effective treatment. And that is empowering, and I'm proud of that.
Good. And I think that you should be, because if you think about things, we are not a practice of just a little bit of this injection or a little bit of that injection. You know, we are seeing people who, we have complex acne even nowadays, and sometimes we need to refer onwards. It would be hard, I would imagine, for a non-medic to refer to a consultant dermatologist. I'm not quite sure how that would work. We're able to write to a consultant in order to have a second opinion or to pass them on. And then the other thing is, of course, is that with your nurse training, you've probably been used to dealing with people that have been in very ill situations, their family, etc. How much of that nurse training comes into dealing with frankly saying to somebody, I've just noticed a little lump on your neck, for instance. Do you think you'd have been able to have said that to somebody before you were a nurse?
Well, I don't know that it's would I have been able to say it. I think it is would I have even acknowledged it, would I have been aware of it. And it comes back to assessing someone completely and seeing any danger signs or anything that we think maybe you should go and have that explored a bit further, or I can support you in this.
Yeah, like by coaching what to say in terms of the 10-minute NHS GP consultation. You can coach your patient to get to the point quickly.
Exactly.
Yeah, what would be important.
I mean, you're excellent at it. You, for example, you just said goiter, but you were just telling me a story the other day where you met a patient and you've been doing it for many years, but you'll see something. Because I don't know how many years you've even been nursing, Maria. I don't dare say.
No, not on camera.
No. But you know, you can spot something so quickly, and you've mentored me to do the same thing, but you'll see something and you can very pragmatically educate a patient and inform them and guide them as to what to do next.
Yeah, so I'm thinking, would a non-medical practitioner, one, notice that, and two, know how to address it and where to send? So in all of those things, you have that with our practice. A nurse-led practice is very nursey, isn't it?
Yeah. I mean, we have non-medical practitioners. We have our aesthetic therapists, but they're brilliant, and they work alongside us, as do a lot of practices. But it's medical led, so our team know that they have us behind them. We consult the patients in the first instance, and we can continue to mentor and coach the team. But we work as a team collaboratively, and I think that delivers a really good service.
Yeah, exactly. And I think it's really good to edify our skin and laser therapists to the patients if we first of all consult, because obviously they know a lot more about the machines that they're using than we would.
Yeah, they're amazing.
Exactly.
What do you say, and I love hearing your feedback on this, what do you say when someone says, so often it's like a new patient thinking, I want to look well, I'm scared of looking done, and I don't want to commit myself to having to come and spend a lot of money or have a lot of treatment, both either every month, every 6 months, every year. How do you coach that patient? What's your sort of favorite turn of phrase for that?
First of all, I would really ask them, so what is your end goal? And of course, I want to manage their expectations. So for instance, if you only want to come once a year, we have to think of what once a year treatment would have the most, if you like, bang for buck. And quite often that is an injectable dermal filler treatment with some maybe muscle relaxing. I think the very root of nursing is about concordancy and concordant agreements. And what that means is, of course, both of you, the nurse and the patient, coming to the same agreement together. So I like for the patients to feel like they're on the team and say, so, you know, this is one thing that we could do, this is another thing that we could do, and these are the provisos. You know, what decisions shall we come to? And if they need more help, then I'll address it slightly differently. But does that help?
It does.
What you were asking.
And one of my favourite things that you've taught me is when to assessing a patient and the confidence to say, I think you would be best suited to surgery. Now, not everybody has to have surgery, and we can still treat somebody who may be best suited to surgery, but it's a nice empowering thing to be able to do for a patient when we can set expectations and say, I can refer you to a really good plastic surgeon, ophthalmic surgeon. You know, you can get an eye lift, for example, by doing this, and we can refer you to somebody that we rate. That's really nice in your experience.
Yeah, and we forged those relationships with here in Oxford, local plastic surgeons, and also in London, etc. I think that's very reassuring for the patient, because they know that we know the work.
Yeah. Marea, what is phi?
So phi is a naturally occurring ratio which exhibits aesthetically pleasing properties. So naturally occurring, the universe can be measured in phi, rose petals measured in phi, snowflakes, the nautilus shell, it's all over the place. If you chop an apple in half and look, and then if you were to measure the ratios inside the pattern of the apple, it would all go back to the measurement of phi. It's a mathematical formula, and it was obviously observed by somebody very much more observant than I. However, I would say that we would have an aesthetic eye that naturally recognises it.
I mean, it's fascinating, isn't it? Because we could argue this for hours or discuss it for hours. Everyone says beauty is subjective, it's in the eye of the beholder. And yes, but fundamentally, you can measure it mathematically. And you think, well, beauty's in nature, beauty's everywhere.
Yeah.
What is beautiful, what isn't beautiful?
Yeah.
But I think the importance is that we use what's naturally looking beauty when we're observing and treating and planning.
What's more natural than the rose petals, the universe?
Yeah.
And we have talked about this in the past, haven't we? Whereby you and I are of the belief that there should be no trends in medical aesthetics, because it's not a fashion thing.
No.
It's more about looking your best, and you were talking about this in the coffee break earlier on.
Well, it's a fascinating one, and I think maybe different practices may see different patient cohorts, you know, so, and some patients may want to follow a trend, but I would never follow a trend myself, and I would never treat following a trend, because it is just that, a trend. And a lot of patients, the first thing they say, I was just speaking to someone earlier, and they said, oh, you know, is phi about looking younger? And I said, actually, no patient has ever come into me and said, I want to look like I did when I was 20. No one wants to technically look younger. They just want to look well for their age. What patients come in and what they want and what we deliver. And there's this misconception, I feel, around medical aesthetics, around Botox and fillers, and even medical facials that we offer, that all of our patients are coming to us wanting to look younger, wanting bigger lips. And basically what happens is new patients come in, and the first thing they say is, I don't want to look younger. I'm not interested in having my lips done. I don't want a trout pout. And they list off what they don't want before they've even gotten to what they do want. And what they do want is to just look how they feel, and they want to look their natural best, because the aging process can occur for a multitude of reasons, can't it? Illness, grief, stress, the menopause, poor diet. There's loads of things, and a lot of it's out of our control. Some of it's in our control, such as diet, but sometimes it's not. Illness, stress, the menopause. And all we're doing for patients is not making them look younger, although inadvertently making someone look fresher and better, weller, more. How would you say that? Just
dynamic, or vibrant.
Vibrant's a good word. Inadvertently makes them look a little bit younger. It does take some years off, but I think it's because they've had years unfairly put on them because of life, social work, and working around that triangle, the golden beauty of triangle. Often what we're doing is just re-feminizing a face, or making a male face more masculine.
Because unfortunately, nature has sort of like a practical joke up its sleeve. So as men get older, they get a bit boobier, and as women get older, they look a bit more masculine in their face, with either lines across their foreheads or squarer face because of jowls. So thank you, Creator. But this is the sort of thing that we understand, to try to tilt that triangle, if you like, so to look like that rather than to look like that. No, I think it's reassuring for our patients and future patients to hear that we have all these considerations.
And no one ever looks done, and that leads on to how often do you have filler? How often do you need to keep coming back? And I asked the question earlier, and you said it's down to the patient and what they're looking to achieve, and the treatment plan that we agree to. But things like dermal filler lasts so much longer than anybody admits to. And aside from improperly placed filler, which can cause puffy face, can't it? That sort of puffy look. Too much filler can cause someone to look puffy, because it goes in and then it takes months for it to really look great.
Because you've got the collagen stimulation effect. And it's true to say that we probably say different things now to what we said 10 years ago, because there are some practices using ultrasound to look at the face, and they're noticing that people who haven't had filler for years have still got filler residues on the ultrasound in their face. So I think it's an important thing for anyone who's considering coming to us, that it's not like supermarket purchasing, whereby you think, I'll go for my regular dermal filler Botox combination. It's best to think, I'll go and see and have a consultation about what might be pertinent now. And of course, it's nice for people to know that nobody needs any of this. It's only the nice to have. So we don't say about you need this or you need that. We're not that directive. But we will say things regarding health. For instance, someone says to us, do you think that got more lines and wrinkles than you would expect here? We'll ask them about, what's your behaviours like in the sun? How much sugar do you eat in your diet? Because that's very aging, isn't it?
Yes. Highly sugar, sun exposure. Are you a sun worshipper? But that's really interesting about saying what patients need and how directive we are. I like to be quite directive when it comes to my patients' health. But when it comes to the image, patients say to me, and even friends, it's like a dinner party conversation, isn't it?
Oh, no, it's awful.
What would you do to me? What do I need? And I always say, you don't need anything. No one needs anything. But what's bothering you? What are you really aware of? Do you feel like you look angry all the time? Do you feel like you look tired all the time? Because that's what I can enhance and reverse to a degree. But it's interesting when patients say, what do I need? And you have to sort of precariously go about it to say, well, how do you feel?
Exactly.
What do you see when you look in the mirror?
Does the image that reflects back at you, is it accurate to what you're thinking you should look like? That's with what's inside and how you feel with your energy levels? I think people like to look dynamic and full of full of life. I think most people would prefer not to be told you look tired.
That's the worst thing to hear, isn't it?
And I think that's why it's so good that we offer more than just cosmetic injections, that we offer things for the condition of the skin and the laxity of the skin. What's your favourite product for the condition of the skin?
Oh gosh. So as you know, I'm a huge clinical advocate, and I absolutely, at the moment, I'm really loving moisturising complex, but I've been using something, so topical product wise, I've been using something called polyvitamin. So it's got a really high hyaluronic acid percentage in it, 40%, but a bit of retinol, and I use it at night time and I love it. And I'd like to marry that with treatments. So I like to say I get a hydrofacial every month, but I don't often get time to have a hydrofacial every month. So I have Profilo.
Oh yeah.
It doesn't change the structure of my face. I don't want to look like I've had any treatment, especially doing what I do, but it locks in moisture, so it keeps my skin looking and feeling nice and tight and hydrated, and it's nice and preventative from getting too deep lines. So I like Profilo combined with my clinical use. I absolutely love it. What about you?
Well, I really like Profilo because I don't want to look overfilled either. For the neck, it's brilliant. For the backs of the hand, it's brilliant, and chest as well. I don't have a lot of experience with it on abdomens, but indeed it's licensed to be able to put onto abdominal skin. But I think people want to spend their budget sort of like here, really, don't they? And then if they've got a bit more budget, it might go to there and then go to here.
Well, let me tell you about abdomens and Profilo, because I've been doing, as you know, I cool sculpt, and I've been doing cool sculpting tummies, and where we've gotten some really nice tight abdomens post baby belly, I've got loose skin, and Profilo combined with skin tightening. There was a celebrity who posted this recently, and I don't know that they had Profilo on their tummy or not, but I think it was skin tightening they were promoting. But I've done this on a couple of patients, Profilo skin tightening post cool sculpting, and it's fantastic.
Great.
Because it's that skin laxity after you, especially after you've had a child, especially for petite women, you know. Cool sculpting will get rid of the unwanted fat. And it does tighten the skin to a degree, but if you've had a real stretch from pregnancy, it's really difficult to return that. So by hydrating it with Profilo and then stimulating the collagen with skin tightening, it's really nice.
Yeah, I mean, don't fill my head with too many ideas. I'll be asking. I'm not that I've got the same underlying condition, but yeah, I mean, as you say, you don't get a lot of time to have what you would like to have, but it is nice to look after yourself. It is nice to have an hour on the couch and have some skin tightening.
Or an hour of a hydrofacial, you know, even just for my stress levels, and that LED mask and the massage the girls do, and you feel great afterwards, hydrated, tight, glowing.
We don't always thank our bodies enough, do we?
No.
For keeping us upright and... So maybe it's a new way of looking at it, really. You know, we see people that say time for me, but it's also a little bit like speak to your body. You know, like I say, if you can't lose weight for yourself, lose it for your knees. Yeah. You know, and go, there you are, I'm going to give you a treat.
Well, I think as well we get to this this sort of state in society where everyone's talking about doing something for me, doing something for myself, and sometimes it can get a bit much and you think, oh gosh, I'm okay, I'll cope. But actually, what I also like to say is you're no good to anybody else if you're not taking care of yourself. A bit like cabin crew, doors check, you know, do your own oxygen mask before the next person.
And then you can help others.
Not that I can like a hydrofacial to an oxygen mask. Although I'll try. But I think it's a really good message. If you're feeling stressed, if you're feeling tired, if you're not feeling great, then do something about it. And it's a simple solution and we can help. And then you're great for everybody else.
I mean, after all, many people have got golf subscriptions or gym subscriptions. Might as well have a Time for Me subscription.